orthopaedics, bones and joints and muscles, soft tissue, abdomen, chest surgeries. We did an open heart procedure. Just the sweetest patients, getting to help them just because of their wonderful nature and the joy they bring to their families. A couple of days later, they're up and walking out of the clinic. That's incredibly rewarding.
We have a very special guest today, Dr. Mike King. He is a board-certified veterinary surgeon at Canada West Veterinary Specialists.
Pleasure to be here.
I thought maybe we'd just talk a little bit about what it means to be a board-certified veterinary surgeon, what it takes to achieve that accreditation, and what your typical caseload might look like.
Sure. Being a specialist surgeon means that I've done additional training after vet school. So for most veterinarians in North America, you do an undergrad for 4 years, and then you do your DVM veterinary training for 4 years. And then to become a specialist, you generally do between 4 and 5 years additional work with an internship or a couple of internships and then a residency where you're focusing on that one area. And it means you hopefully get really good at that particular part, particularly with, just the knowledge of everything with it. It does mean you start to forget some of the more, routine parts of veterinary care. No, it really is a focus on being a specialist, meaning that we know a lot about a small area. So that's sort of the journey of getting there. What it means on a day-to-day basis for me is the kind of cases that I see. So I tend to see almost exclusively cases that have come from other veterinarians who have a procedure that requires particular training or particular types of equipment to get done, or have a case where needs particular diagnostics or investigation to figure it out. Lamenesses being the best example. Some more tricky lamenesses can be something where we can step in to try and figure that out with not only our experience, but also the team that we have around us at the practice as well, with radiologists and internists and critical care specialists and things like that. So we have access to things like CT and MRI, and also things that don't sound as fancy but are really important, like ultrasound of the muscles and tendons, which ultrasound is a really common thing that a lot of veterinary practices have, but there's not many veterinarians other than radiologist specialists who feel comfortable assessing tendons and ligaments and things with ultrasound. That can be hugely helpful to try and figure out what's going on in a dog and figure out the best way of treating them afterwards.
Cool.
Yeah. So I'd say probably about 60 to 70% of what I do is orthopaedics, meaning bones and joints and muscles. So torn ligaments and broken legs and things like that. But the sort of other 40% is what we call soft tissue. So it means abdomen, chest surgeries, big wounds where we have to manage those and reconstruct them. So it's quite varied. And I think that is the fun part of being a veterinary specialist rather than a human specialist, is the variety of what I get to do. I might have a lung lobectomy in the morning and then a complicated fracture and then finish up with reconstructing a dog's big bite wounds or something like that. And so we're not nearly as narrowly specialized as in human surgery, but it does mean that we get a bit more variety to our day and what we get to do, which is really rewarding.
Cool. Awesome. Next question. What are some of your most memorable or rewarding cases that you come to mind?
Lots of really complicated fractures where you've got a dog that comes in that's in a really bad way, and then you can reconstruct them, and a couple of days later they're up and walking out of the clinic. That's incredibly rewarding. The one case that is probably the single surgery highlight of my career so far was a dog with a heart condition that I believe you were involved in.
Behind the scenes.
No, but a young dog, a puppy that had a condition called cor triatriatum dexter, which is a fancy word meaning that one of the 4 chambers of the heart had an extra separation to it and a tiny little hole that the blood was trying to get through, which caused a lot of backup and pressure. So through our cardiologist and then with me and our critical care team, we did an open heart procedure to break down that membrane and let him get back to normal blood flow.
Yeah, there's a lot of collaboration amongst specialists and even different hospitals. I remember
Absolutely.
The cardiology team at Colorado State was really involved in that case too.
That's right.
All the way from Colorado trying to help out. And
yep, we had big discussions with them, and absolutely. So that was a really rewarding thing to do.
There were like 10 specialists in the OR.
Yeah, that's right. He did great. And since then, I've actually operated him a couple of times for cruciate ligament ruptures, which is another very common thing we see, because he's turned into just this super active, happy dog who has a wonderful life somewhere up where you are, actually, I believe, and is just running around trails and having a great time. So I think he's the single case that's memorable.
That is so nice. Yeah, to go from probably close to death's door all the way to running around and blowing your knees.
Yeah, exactly. I know, right? He's great.
That's so cool.
But I think that overall, honestly, it is the pets and often the owners that is surprisingly rewarding too. You know, you think about surgery being the fun part, and for me, a lot of it is, but there are some wonderful pets from my training early on through to this. That dog I mentioned to you is a wonderful dog, and the owners just are so cool, and it's wonderful to see him back for little visits and things. Some adorable dogs that I remember from my residency even that were just the sweetest patients, and getting to help them just because of their wonderful nature and the joy they bring to their families is probably what actually is the part that keeps me inspired.
Cool.